All right. Have you had a chance to access the wellness guide? And you can put it in a chat or just unmute yourself because there's only a handful of us here. To take a look at the wellness committee guide in the Google Classroom.
I have not, because I'm not one of the instructors. I kind of oversee the project here. So, but Jenny has, and Jenny will be joining us soon. She's just finishing off a program.
Oh, okay. So hopefully she's taken a look and maybe there are some questions that they have. Anyone else?
I mean, I've started looking at it a little bit. We already have a wellness committee. So I just kind of want to see kind of what this is to see if we can do better with our wellness committee that we already have established.
Okay, great. And are you part of the wellness committee or I'm sorry?
I am not on the committee itself. One of my direct supports is, so I kind of know what's going on with the committee, but I'm not on the
Okay.
committee.
Okay, so as long as you have someone who is kind of connected or closely works with you, that's great. So with this PowerPoint, I'm basically going through the wellness committee guide and just kind of giving you an overview of how we put it together. If you have a wellness committee, the pieces of committee membership and all that may be informative or may not be, but otherwise we kind of are giving you a year in a life of a wellness committee. So with an example of if you're using 12-week Health Matters program, and then just kind of including the activities that you already have as well. So please stop me and let me know if you have any questions. So the goals would be to give you steps to establish a wellness committee, give you some sample activities for a year in a life of a wellness committee. And all of these resources in the wellness committee is really tying or trying to tie it together with strategic action planning for health promotion and some evaluation strategies on organizational level and the 12-week Health Matters program level. So that way you are still continuing to build capacity for health promotion in your organization. And then lastly, I want to make sure that I'm answering any questions that you have.
Sorry, go ahead.
Yeah, go ahead.
I was just going to say, we've got our Health Matters steering committee that's been around for almost 2 years now. We've offered how many sessions, Jenna? We've done 3 groups. 3 groups already. Expanding to another 3 and we're expanding to another 3 for the summer. And we've actually had, and thank you very much for giving us spaces for to train staff in this wonderful program. We have about 9 people who are running, and they're doing it as in teams of 2 or 3, depending on where they are in their learning. So yeah, so it's been a real wonderful program for us.
I'm very glad to hear that, and hopefully you'll get to continue. We are announcing fall dates sometime this week if we get around to updating the website. But we have the fall dates for additional, if you want to train additional staff coming up too.
Great, and I'm sure we'll take you up on it because we feel the more we can get trained, the better. And we've learned a lot. It's been a learning experience. We've had some hiccups, there's no doubt about it, but we've trained some people who now have moved on to other things, but so yeah, every opportunity is appreciated.
And that's the entire goal of having these continuing trainings, because we do recognize that people either move or are no longer with the organization, but we still want to continue that capacity for health promotion. And hopefully what the Wellness Committee Guide kind of gives you is to solidify some of this capacity, and in thinking about strategic action planning, thinking about long-term and short-term goals for a year or for the next several years, and then how to evaluate. And I'll give you some of those examples, and that's all in the Wellness Committee Guide as well, but I'm just kind of summarizing the guide. for you. I really hope that you read the guide. It can be downloaded from the classroom. If you go to our Virtual Coach Health Matters program, Google Classroom, it's under classwork, and then Wellness Committee Guide is its own little section. And the page numbers that that are kind of posted in the PowerPoint deck corresponds to the Wellness Committee Guide page numbers as well. So you know where to kind of look, or if you even have printed out the Wellness Committee guide, or you have it kind of handy, you can kind of look through those pages as well. So just really briefly, what is a wellness committee? It includes a team of employees, volunteers, self-advocates, and family members who formally meet and plan activities to promote good health for people with intellectual disabilities and employees in the organization. Oftentimes, if there is a wellness committee, it's sometimes only for employees or only for people with intellectual disability, but we really would like to think about, if you are starting or if you even have a wellness committee, to kind of connect the two together. So it is a wellness committee for an entire organization. It does represent, again, people with disabilities and employees. And the goal is to communicate to employees and people with intellectual disability information about health and the value of health promotion initiatives. Additionally, it's a good way of creating and maintaining ways of communicating those health promotion activities and health promotion messaging to a broader, in general, organizational, sort of across organizational departments. Oftentimes, and I talk about this during our training, we see health promotion is very strong in one area or unit within the organization, but it does not kind of go across units. So hopefully the wellness committee would help with that. And then it promotes participation. It advocates for organizational policies and environments to support improved health. And I'll talk a little bit more about that. And then it coordinates the monitoring, what kind of activities, it kind of puts everything in one place. What kind of health promotion activities does your organization have? And what are you doing to evaluate those health promotion activities? And then lastly, wellness committee is a leader or champion of health promotion within your organization. So we really, when we do larger trainings, and we do it on that capacity building organizational level, we talk a lot about wellness committee. But when we do the 12-week program training, the 3-hour trainer webinar, it just gets, there's not enough time to cover all of this. And I really have always hoped that more organizations would take me up on listening and starting a wellness committee. And we really, really try hard to get people to do that. And then with wellness committee, it helps with strategic action planning. So if you're thinking about, as I've mentioned, cross-departmental outreach, but it also is good and important if you're thinking or reevaluating those policies, your organizational policies. Do they even have health promotion written in them? Job descriptions, and then in general, job evaluations. And then additionally, including health promotion goals and objectives for people with intellectual disability into required treatment plans. And then it's addressing motivation, time, funding issues, and turnover as well. And then this is, again, from the Wellness Committee Guide. It's how a year in the life of a wellness committee looks like. The first is to identify committee members and get started. Then the first meeting is really calling to establish the committee. And I'll just get into like how these meetings can look like. We usually recommend about 9 meetings in a year. You don't have to meet every month, but you can. And just out of curiosity, whoever already has established wellness committee, how often does your wellness committee meet? You can put it in a chat box. I'm just curious. Then we will talk a little bit about, in meeting 2, evaluating capacity for health promotion on organizational level by using HealthMatters assessments. And these are also in the Google Classroom. Thinking about setting action plan and program evaluation, and I'll touch upon in different meetings, and I'll explain further process-based evaluation and post-program evaluation. Okay, every 2 months, thanks, bi-monthly. And then thinking about what do you do with those evaluations and results, how to interpret and analyze the results and set next steps, outreach and dissemination, and then how to present results and next steps to the broader audience. So I'm really taking snippets of different meetings in the guide and just kind of placing them here so you get a better picture. The Wellness Committee Formation Checklist, we have developed it, and that's located in Appendix A of the guide. But the checklist goes to for you to think about identifying your wellness sponsor, which is usually a senior management, to ensure organizational and financial support. You choose a wellness committee lead, someone with a passion for wellness. It doesn't have to be someone who is, has a degree in health. Then determining the size of your committee, and I'll give you some recommendations, and depending on how large your organization is. Obviously, getting supervisor approval for potential committee members' participation, recruiting committee members. We even have developed a sample invitation email, and that's also located in Appendix. That's Appendix B. And then, of course, each member is asked at least 1 year commitment for each member to participate in the committee wellness committee. And then working with your wellness sponsor to possibly set a budget for the committee. And, when we talk about budget, it doesn't have to be necessarily monetarily, but it's more about having, member committee time to meet as well. Not just having the working budget. Oftentimes, you may not have a working budget unless there is a grant or a carve out for health promotion in your organization. So identifying committee members, this is just a rough estimate. If you have, depending on how large your organization is, if you have fewer than 300 employees, about 3 to 8 committee members, 300 to 1,000, 8 to 12 committee members, and then over 1,000, 12 or more committee members. We always talk about starting small. So you can even start with 3 members, and then you kind of hopefully can grow it. The important part is that you don't, that the committee members don't get burnt out in the first year. So you do want some sort of division of labor, and we do talk about that a little bit in more detail in the guide, but I won't get into that here. Of course, who would be committee members? They should be broadly from different departments in your organization, members of management and support staff, volunteers, potentially even professionals in the field, or even program partners, family members, and people with intellectual disability. With an existing committee, if you have an existing committee, you can also think about either expanding it, inviting additional members, or if there are any other committees that are similar to health promotion, even focusing on those members to become part of a wellness committee. Obviously, supervisor approval. All committee members should have their immediate supervisor support for the time and work they dedicate to the wellness committee. And employees may need to revise their annual work plan to reflect their duties in serving on a wellness committee. Since we are talking about 9 meetings, the first meeting is about 60 to 90 minutes, and the other ones are about an hour. So you can kind of calculate the time requirement. In the first meeting, you would use that time to establish a committee. That's why it takes a little bit longer. The committee would follow and come up with an action plan. You would select a name for the committee, and usually committees have a mission statement. We have provided examples of the mission statements in the guide. I won't go through them. And then establishing communication plan. So for example, when we talked about 12-week Health Matters program, we talked about the flyer, or how do you recruit participants with disability. So there's a way of, you would be establishing how to communicate activities of a wellness committee to a larger audience. And then this is where you would start introducing Health Matters assessment survey. And I'll talk about that in the next slides, and action plan worksheet, which is Appendix F. Let me know if there are any questions so far, so I can stop and address them. I don't want to be just breezing through this if there is any confusion. With Health Matters assessments, we don't talk about them during the train the trainer, the 3-hour training, just because we run out of time, but we have developed these Health Matters assessments that are looking at organizational capacity and organizational needs assessment for health promotion. And this is a really nice way of answering some of the questions. Just committee members can do those, look through the survey, and that's been uploaded in the Google Classroom, and you can use it. It's under the Wellness Committee section. And you can really kind of, as committee members, take a look at the survey questions and, look at the capacity. What are the things that you already have that are health promotion related versus the need to do health promotion activities. It also looks at structural pieces for health promotion. What do you have as in the means of physical environment, but it's also looking at policies. It looks at attitudinal attitudes of staff towards health promotion. So it's a really nice way to kind of get started and to help you get strategize and write your health promotion strategic action plan. So we in the past, in another grant that we had, we required organizations to, if they didn't have a wellness committee, to establish a wellness committee if they were part of Health Matters program. And this is one of the guide. We used this guide to help them establish a committee. We also would survey their staff with this Health Matters assessment survey, and then we would create a report, and we would give them sort of high, average, low on the kind of different scoring for different rubrics that were in this in the survey. Obviously, we don't do that anymore, just because during COVID, it was just, we were just lucky to give service providers 12-week program for them to get started. But this is kind of another layer or another level of building that capacity for health promotion programming. So if you have any interest in analysis, we can talk about that. It does take a lot of time because the analysis happens on our end. But we can get more talking about that if there's any interest on your side. So with those Health Matters, I've kind of explained, it really is to produce data, verify results, improve the delivery mechanism, look at if your program kind of, what are the outcomes of the program on that organizational level? And then describe the program for replication. So with that strategic, hopefully Health Matters assessments feed into strategic action plan for health and wellness. And this is where you start thinking in the wellness committee about what is the goal, what are strategies and steps that you are trying to reach with the goal, the timeline, who is the team. So this is, you may even have subcommittees at some point. Do you have a budget? How are you communicating to the broader audience? Are you evaluating, and who are your partners, if you have any external partners? In meeting 3, this is where you really are focused on looking at Health Matters assessment survey, and if there's any results, or even just looking as a committee at those surveys and questions, so you can start to develop strategic action plan and those short and long-term goals, and starting and thinking about where does the 12-week Health Matters program fit, and what are the other activities that you already have established there in your organization, and how does it all fit together as sort of a large umbrella of health promotion in your organization. In meeting 4, you start thinking about process-based evaluating. So that really helps you understand how health promotion program works, and how does it produce results. So what are the goals of individual people or participants of the program? And then what are those organizational goals, and where do they meet? It's very useful to do process-based evaluation when to identify problems within your program, and then potential solutions as the problems arise. So we always talk about, I don't know if you recall when we do the training, to really focus on adapting. We give you sort of like the most ideal how the program should look in your organization, but we also recognize that not every organization can run the program the way we've tested it. So we give you some flexibility to still have a successful program and adapt it, and maybe even, it ends up looking very different, but you're still using pieces of Health Matters program. And then you're really thinking about, and this is specific for Health Matters program, but these questions can be applied to any any other health promotion activity that you have going on in your organization. So checking in, how is the program going? What do people with intellectual disability and staff who are leads consider to be strengths of the program? What are those typical complaints that are heard from people with intellectual disability and staff? And then how do people with intellectual disability and staff recommend improving the program? So you're really involving people that it matters the most to kind of come up with the solutions with the programming. And then for any of the activities that you have, the 5th meeting would be post-program, would be thinking about the post-program evaluation. So these would be more focused outcome measures that are, what are you hoping to accomplish with the program at the end of the program term. So with the program, with a 12-week Health Matters program, we have the time 1 and time 2 evaluation, and we have specific measures that we've discussed during the training for that. But are you able to even come up, if you have another activity, how are you going to come up with measures that would be kind of reflecting the outcomes of the program? And then that's kind of this meeting 6, analyzing and interpreting results. We've talked about process measures, which are still really strong evaluation measures. And those would really, those are very helpful to report the successes of the program, such as number of participants who completed the program, number of participants in screening, or risk assessments, if you're having that type of program, number of participants in health education or skill activities development, participants that received and follow up with referrals, number of people who are enrolled in health promotion programs in general, number and types of educational materials that were either produced or disseminated for the program, number of partners, internal or external, that are involved in the program, the number of people that may be aware of program messaging and are intending to take action. Did you have new policies developed because of some of the programs? Types of program activities and settings, et cetera. And then, so that would be considered the process measures. And then the outcome measures really are a little bit more on that individual level, where you're looking at changes in health status. Did people modify or adopt new healthy behaviors? If you're looking at medication adherence, prevalence of risk factors, improve healthcare costs, policies that are enhanced or implemented, and then changes in knowledge and skills. So if you look at 12-week Health Matters program evaluation surveys, time 1 and time 2, a lot of the questions and a lot of the measures that we use do reflect those outcome measures in the right-hand column. Any questions on how to analyze and interpret results? Just stop me. I'll keep going so I can have more time for you to ask questions at the end. And then that meeting 7, and just keep in mind that these activities, we had to kind of put them in specific meetings, but I just want to make sure you're getting a sense of how a wellness committee, or what the activities could look like in a year of a wellness committee. And you can, again, adopt the guide. Nothing is set in stone. So, for example, if you're finishing up with a 12-week program, you may want to think about results of the program, looking back at process and or outcome measures in the previous slide, reporting on successes and challenges. So those can be even voiced from participants with disability and staff. What are the next steps? And then you may want to review Health Matters assessment survey the second time and look at, in general, have any changes been implemented in regards to any of the measures that are in that organizational Health Matters survey. So that's kind of thinking about those next steps and dissemination. And meeting 8 would be considered an open meeting, where you would invite a broader audience, people with disability, family members, board members, employees, and partners, and you would kind of present the results of a year of Health Matters or health promotion activities in your organization. And again, this would go beyond the 12-week Health Matters program, but you would want to include any other health promotion activities that the Wellness Committee has worked on. And then thinking about, do you have any changes that you can address, or you can record with the Health Matters assessment survey. And then at the end, the year-end meeting, it would be, you would gather as a committee and you would evaluate committee activities just amongst themselves. And then you would kind of set some broad recommendations for next year, kind of what's looking ahead, looking at those long and short-term goals, and just kind of outlining some next steps with the wellness activities. Any questions? The list of appendices that I have here are from the, oops, I'm sorry, those bullet points got all messed up, but it's just a list of appendices that I have from the Wellness Committee guide. The first one is Appendix A, Wellness Committee Formation Checklist. We have some sample email of invitation to serve on the Wellness Committee. We also have a Wellness Committee member invitation poster, or if you want to just use it as like a mailer in an email or in your listserv. We have a Wellness Committee members form, sample agenda. All of these are in Word format, so you can edit them. Wellness Committee action plan, informational flyer for participants. That's the Health Matters program one. So you can edit it if you're having another health promotion activity. You can edit that one and use it. There's sample email if you decide to do Health Matters assessment survey. And then participant evaluation of any in general wellness activities. So Appendix I is any type of health promotion activity that you may be doing in your organization. We have a sort of a generic evaluation for that. And then the last appendix is evaluation of wellness committee by committee members. So kind of your last end of the year meeting evaluation. All right, so that is all I had in regards to the Wellness Committee Guide. Any questions, comments, anything that I didn't cover, or anything that you expected that I would be talking about that I might have not said? So let me know, please. I'll just put myself back on the video. So I don't have anything else to say, but I just want to answer any questions that you have. No questions? Oh, there's one in the chat. No questions at this time, okay? All right, well, if there are no questions, you can always contact me via email and we can, hop on
I
another.
apologize, I keep getting kicked off.
Oh.
This is the second time it's happened where all of a sudden it all disappears, and then and I was in mid-sentence then. So.
Oh. Oh, so Anne, you had a question?
No, actually, no questions. I just wanted to thank you and just say this was a good presentation. But we went to the Google Classroom and couldn't access the document you were talking about. So we're just wondering if there's something.
You weren't able to see them at all?
What would it be under on the Google Classroom?
So if you go to if you go to the virtual classroom, you will be go under classwork, and you're able to, it's the second major section. It says Wellness Committee Guide. Are you able to see it? Here, I'll show you how it looks. It's under class. The first one is team complete this section first, and the next one is Wellness Committee Guide. Are you able to find it? And if you click on it, all of the appendices, if you click on it, all the appendices and the,
Sorry, we're back again.
oh, okay.
Got
Were you,
kicked off again.
yeah, that is so strange.
No,
So
I think it's on our end. It's
Our
not yours.
internet.
It's our internet.
okay. So if you go to classwork,
Yeah.
there's team complete this section first, and then there's Wellness Committee Guide. And if you click on that, everything that I kind of covered is in that section.
It's for internet.
What was it?
Yeah, we got it. When I was looking it up, I think the phone wasn't picking up the internet, so it didn't download all the stuff.
Okay, yeah. So including Health Matters assessments. So if you look at Health Matters assessments, let me know. I just clicked on it, so hopefully
I
you're
have
able
it.
to see them.
Yes.
So the cool part about this survey that we've used, and we've created it, the sections are available program and services, promotional messaging, wellness committee, environmental support for health promotion, resources, so organizational resources supporting health promotion, local community resources supporting health promotion, organizational culture that includes commitment, policies and incentives, and structures, workload, and then employee knowledge related to health promotion, employee skills and attitudes, and kind of outcome expectations. What is good about exercising? And then confidence to exercise. Do you think that people with intellectual disability can exercise? So you're getting some, again, attitudinal. And then the barriers that keeps people with intellectual disability from exercising. And then what's good about eating fruits and veggies? And do you think that people with ID can make healthy food choices? And then the barriers to nutrition and demographics. So it's such a neat survey that you could survey the staff. However, you could almost use it as a checklist of things that you already know is present or not present in your organization, or you can even use specific questions and ask staff if you're trying to like change the specific behavior, or if you're trying to learn how the staff feel about this. So it really was such a neat tool that we developed years ago when we had a community academic partnership, and we're able to implement it with multiple organizations. I wish we could still do it. The analysis cost a lot of money to do it, but it was such a nice thing for each organization to have a report on health assessments. So anyway, that's I just like the survey. So so anywho, that's all I have. Any other questions?
No, we're good. Thank you.
Okay, so I will stop sharing. Thank you for participating and coming.